Hey, how's it going, Robin?
Hey George, I'm good. How are you doing?
I'm doing good. It was awesome. Just for the listeners to hear, we were able to actually meet up a couple of weeks back at one of the ATA conferences.
Yes,
We got a star in our presence. You were part of the ATA TV programming going on there, but it was awesome to see you that day.
I was. I'm getting more and more comfortable being in front of the camera, but it was a great conference. So it was great to see you in person.
Awesome. Yeah. And, virtually today, and our last podcast, we had a great meeting. We discussed a little bit about orthorexia nervosa.
Yes.
There was a lot of things I feel like I learned about, the discussion we had. And what's awesome today is we're going to expand on the topic of body image today, something somewhat related. And we are very, very excited. We have our guest, Kelly Porter, here with us today. So I'm just going to give a little intro to Kelly. So thank you for joining. Kelly has a history of working in residential mental health programming, and youth development. She has published psychological research and presented at the 2019 Spokane Intercollegiate Research Conference. She currently works as a behavioral health technician and education liaison at an outpatient treatment center in Phoenix, Arizona. She works with the youth to support them through their treatment and is passionate about diversity, equity, inclusion, community advocacy. Oof. So it's a lot on the resume there. So we're very happy to have you here today, Kelly. Thanks for joining us.
Hi, George and Robin. I'm happy to be here.
Awesome, awesome. So, I like to start off, first time meeting. Can you just tell us a little bit about yourself, Kelly?
Yeah, absolutely. So, I have my bachelor's in psychology from Gonzaga University in Spokane, Washington. Right now, I work at, like you said, an inpatient eating disorder facility in Phoenix. So, a little bit about what I do. I spent over a year as a behavioral technician where I was spending basically my entire day with our adolescent patients ages 10 to 17 and just providing sort of like a crisis intervention and general support system to our patients as sort of the middleman between them and their therapist. And now I'm working as the education liaison at the same facility. So I manage all of their academic coordination, sort of more behind the scenes now.
You guys are in that world, every day. For myself, it's not too experienced with, the world of body image and how that could affect people. Can you just give us a description as to what body image issues may look like, or just kind of speak on the subject?
Yeah. A general definition that I would use in my line of work for what body image is in a general sense, it's the picture or the mental image that a person has of their own body. So it's more complex than just what we see in the mirror or how we see ourselves in a physical sense, but it encompasses the way that someone perceives their body, how they think and feel about their body, and the behaviors that they might engage in as a result of their thoughts and feelings about their body. So it can range on a spectrum between positive and negative experiences. One person may feel differently about their body at different points in time, or they might feel a mix of positive and negative emotions about it. So it is influenced by internal and external factors. So it might just be, someone's perception of their body is a little bit dysmorphic. They might have different ideas about how people see them versus how they see themselves, and that becomes internalized into a sense of a picture that they have of the way that they look.
It's so interesting to me, this topic, which is one of the reasons why we started talking about it with the orthorexia in our last podcast, and hopefully we'll have several podcasts around this because I feel like there is so much to know and to maybe share like informationally. But I know because I'm sure there's a difference between boys and girls in symptomology. Well, maybe not symptoms, but just like what you see, like how a young boy might approach maybe dissatisfaction about their body image as opposed to how a young girl might do that. But coming from the therapist perspective, uh, the thing that we do know, I feel like just in general, is that a positive body image is associated with healthier mental health, meaning I feel better about myself. I feel more capable. I have higher confidence, my self esteem, which then, of course, in turn prompts me to do things and not worry so much, right? Like I'll try this or I'll go meet that group. So, on the, I don't know if it's the opposite, but we'll say so on the opposite, right? The negative, like you're saying, is uh, we see with like, you know, eating disorders, obviously, but also other like you know, excessive exercise, self-harming behaviors, suicidal thoughts, negative self, you know, where they have persistent intrusive negative thoughts about, you know, this person's looking at me and thinking this about me because I have a body that looks like this instead of like that. But I think the thing that has been coming up a lot lately, because these are not necessarily new conversations, but is
Mhm.
this in the impact on body image and how people feel about their own bodies based on what they see, like in social media, Instagram,
Absolutely.
TikTok. It's over the weekend, I forgot, it was seeing, I forgot who it was, and her, you know, like her, what do you call her filter, and they're trying to eliminate this filter because it creates this unrealistic expectation. So can you
Mhm.
talk a little bit about like what you have seen in terms of the impact, especially since you work with adolescents?
Yes, absolutely. I mean, with the age group that I work with right now, it's heartbreaking to see how much the impact of social media has just sort of infiltrated their mental state of being, because being on social media at that age when you're still going through the process of identity formation, it's so impactful for them to be in basically a constant state of comparison. And it becomes that much easier for them to have these, like you said, intrusive, sort of obsessive thoughts about what they're eating, what their bodies look like, how they look in relation to other people, how they look in relation to other people that they're aspiring towards. So they go through a lot of like aspirational comparison of, I want to look like this person. What can I do to look or be or act more like this person? And it's very comparative. And in my line of work, eating disorders in nature are very comparative. And I think when it comes down to social media as sort of a highlight reel of everyone's best moments with editing and filters and Photoshop, it becomes very unhealthy to compare yourself to those sorts of things. And especially in the age group that I'm in, we just see an immense impact, especially with the younger of our group, because they are sort of, I guess you would say, chronically online. They are so integrated in social media and so online that they see these things all the time, and as they feed into it more, they get more and more of the same content. So it really is a vicious cycle.
I love how you describe that as like the highlight reel, right, of everybody's life, because I, it's, to me, I always wonder, it's like how, um, I can't think of the word, how they can reconcile, like if they know that people get catfished, that people are often not who they seem, who they present themselves to be, like literally, like, hi,
Mhm.
I'm not really a 15-year-old, I'm an 82-year-old man, right? So this idea somehow though that when people share images of themselves, hey, I'm out on the beach and I'm over here like having the most fun, the best time, how then they reconcile how this one thing can be true that people are very often don't present themselves in a factual way, then though taking this to heart. So do you think that in all the work now that you've done in this age group, do you think that there are certain people or certain things that make someone maybe disproportionately at risk for
Yeah.
negative body image?
Yeah, I mean, that's an excellent question. And I think one of the biggest things that I see as a risk factor, there would be two things that I would put my finger on. One of them is the child's experience of gender is a huge impact on the way that they see their body, the way that they feel in their body. If they experience gender dysphoria, or if they experience, the feeling of being non-binary or not feeling at home in their body, that has a huge impact on their body image and the way that they perceive themselves, and can have really dire effects when it comes to what we call compensatory behaviors. So behaviors that they use to compensate for the way that they feel like the things they don't like about the way that they look. So gender and their experience of gender is a big risk factor. And I would say probably just the biggest one, it might seem obvious, but a family history of dieting, eating disorders, or just general addiction and mental illness. A family history is something that we see a lot, even just a family history like parents who diet often, or parents who encourage their child to exercise, or have a certain way of talking about food and bodies and the way that people look. Just a sort of general family environment that is not welcoming towards multiple sizes and not inclusive towards different types of bodies. We tend to see that being a risk factor for people in the experience of negative body image.
I was curious as to, you guys are speaking on some of the harmful repercussions from negative body image, and how can you, is there like a spectrum of where someone can fall in that? Like someone, oh, I don't necessarily like how my clothes fits, but it's not something that's taking over my mind on a daily basis, hourly basis, whatever the case is, versus someone that is just constantly thinking negative about their body image. Is there like a spectrum you see often?
Yeah, that is a great point. It is a spectrum, because I think there's a certain level of someone being dissatisfied with their body image, but the compensatory behaviors and, like you said, the obsessive thoughts is sort of where I would say the line is drawn. When it becomes disordered is when it, I think, becomes a different level of negative body image, because somebody can have a spectrum of feelings about their body. So you might at once have positive and negative feelings about different aspects of your body image. So you might like your height, or like you said, you might like the way your clothes fit. But then when you compare yourself to another person, you might think, oh, well, I'm too big here, or I'm too small here, or things like that. So it is a spectrum. I think there's a line between dissatisfied and disordered, where it sort of becomes, a little more than just your average not liking certain things about yourself. Because when it becomes unhealthy is when the behaviors start to come into play, and you start to engage in things like excessive exercise, constant dieting, negative self-talk. Those sorts of things are when it starts to cross the line.
I think, Kelly, that's. I feel like there's a lot in that, and we want everybody listening to really understand, what to look for, maybe in their friends, their family, their children, or in themselves, because in other aspects of mental health, sometimes the person who's having the issue is often not, I want to say, not aware, or not willing to be aware, not ready to be aware, depending on your viewpoint. So, since you see adolescents and young kids, I'll be honest, I'm still a little blown away by that 10-year-old thing. So,
I know.
I just was not
Hard to
prepared for the
process.
10. Yeah. In my head, like, I was thinking, okay, I mean, I know that 10 is not so far away from 11 and 12, which for some people is kind of where puberty kicks in, which is where I was going to go with this question. But I'm sorry, my head keeps, like, the number 10 is literally going over and in my head. And I'm trying to imagine myself at 10 years old, and what a 10-year-old normally would be. I don't know, normally, like the average 10-year-old, like what they do, hang out with their friends. But social media, I feel, has completely shifted who I was at 10 to who 10-year-olds are now. And I know there's a lot of generations in between that. But I wanted to also talk about what you were saying. So, because we everybody goes through puberty. When you go through puberty, your body shifts, your body
Mhm.
changes, our looks. I mean, I remember I call it my ugly year, right? Which freaked me out. Like,
We all have one.
exactly. And that's it. Like, here I was in sixth grade, and I think I was like 11, and I looked so cute in my class picture. But then like came seventh grade, and I was like, oh, wow. And then the next year, I ended up not looking anything like that. It was just some weird year. So, how much does just typical changes because of puberty that everybody goes through, does that sometimes trigger an onset, or do you have you seen that it's already maybe like planted in their mind, like already brewing? What are your thoughts on that, Kelly?
Yeah, I mean, it really obviously depends. Um, Typically with the really young patients that we get, so the ones that are 10, 11, we typically see an extensive trauma history there, which that I think can lead to a lot of the eating disorder behaviors or negative body image that kind of grows and manifests into a much larger issue. But I will say that I think going through puberty is a huge sort of trigger if you're already that young and at risk for it. So if you at that age have already gotten negative messages about your body, about other people's bodies, if you grew up in a family or group of close friends that think and talk a certain way about what you should look like, if you've heard sort of anti-obesity messaging or dieting messaging from school or the doctor, those sorts of things can sort of lay the groundwork at that young age for puberty to become a sort of triggering event that leads somebody into a really negative experience with their body for however long after. Because you would think typically puberty is just a universal experience and that it's just very normal. Um, and again, back to the experience of gender, that experience of puberty can also become, again, a much larger sort of trigger factor for somebody if they continue to grow into a body that they're not comfortable in. So I would say that, you know, for a lot of the patients that I see, not all of them have extensive trauma or anything like that. So sometimes puberty just is what it is, and they maybe will just have the same negative perception of their body from before puberty to after puberty, and that might not be the factor that really snowballs everything. But I think in a lot of ways it can become this event that is almost dreaded as they start to grow up, especially when they start having those thoughts and behaviors so young.
Is that something that you typically see starts at a young age, or is it something that can be developed, later in life, 20s, 30s, 40s, 50s, whatever the case is? And if so, like, is there always like a trigger, maybe like some sort of trauma trigger that'll have that happen to you like later in your life?
Yeah, since I work with adolescents specifically, usually they most, I would say, state that their eating disorder, or that if they had to pinpoint when their eating disorder began, it's usually between 12 and 15, roughly. For adults, typically it's, if they have an eating disorder, it's formed in adolescence. So there can obviously be some sort of triggering event or, major change in someone's body, such as, pregnancy, other sorts of weight gain or rapid weight loss that might trigger, a dysphoric sense of body image later in life. But typically, when it comes to eating disorders and this really constant sense of negative body image, that's usually formed in adolescence. I think, especially for women and also young men, adolescence is when people start to get very aware of how other people are looking at them. And that's when they start to get an idea of whether it's real or perceived. They have an idea of how other people see them in relation to how they see themselves. So typically it's formed around then. But you can see, I mean, the clinicians that I work with have talked about patients that they've worked with who are in their 50s and 60s and still struggling with negative body image or negative thoughts about their bodies, eating disorder behaviors, and things like that. And it typically kind of cements itself later in adulthood, which can be really tough.
I know. I think for me, I've been a therapist for so long, but I agree with you, Kelly. I think that what I've seen, again, very limited, because I'm not an eating disorder specialist at all. Uh, but I think that if something happens in a person's younger life, even if they have recovered, that there can be then other triggers, like you said, like pregnancy is a very common one, right? Or post pregnancy, right? The baby weight
Mhm.
nightmare. But then I'm also thinking, because I'm older now, um, after menopause or during menopause,
Mm.
right? Because hormones shift for women, which maybe somebody that was able to maintain their weight in a very specific way and that way no longer works, and now it sort of kind of unearths old feelings. So I think it is very interesting. And I know the topic of course, gender and gender dysphoria is being spoken about more and more. Not enough, in my opinion, but that I feel like we're talking about two different things almost in some ways, right? Because to me, I always thought about body image as one thing, because a negative body image doesn't necessarily go to an eating disorder. Is that right?
Yes, absolutely.
So then I, before body image became a topic, subject, when we would talk about eating disorders from a mental health perspective, especially anorexia, nervosa, was that it was a control thing for especially in young girls, again mostly because that's where all the research was done, and
Hmm.
adolescents was like if they felt somehow that their life, they were not in control of their own life because of whatever their home circumstances were, this was a way to monitor what they would eat, what they wouldn't eat, and then it became a numbers game and all that. So I feel like there's multiple things, right, going on. One thing doesn't necessarily mean the other thing.
Yes, exactly. I would say it's sort of, I guess, akin to like the squares and rectangles. Like all rectangles are squares, but not all squares are rectangles. All people with most eating disorders, at least, some of them aside, but most people with eating disorders have an experience of negative body image, but not all people with negative body image will experience or develop an eating disorder. Because, like George asked earlier, somebody can be dissatisfied or have a negative experience or perception of their body without it developing further.
Is there any things that you see as a trigger that a parent should maybe start speaking to their kid at a certain point in their life? Just kind of giving them some general information.
Yeah, I guess the way that I see it in my line of work, it seems like the parents who just sort of generally have a neutral way of talking about food, bodies, exercise, that tends to develop into a healthy or generally positive body image in their children. And I would say that teaching their children to have a neutral or positive relationship with their bodies and also all types of bodies is pretty well correlated to a positive body image later on in life. But when it comes to having negative concepts about food, about diverse body types, about exercise, those sorts of things can potentially damage someone's relationship with their body later on.
What are some of the things that where you work are recommended to people experiencing, body image issues, um, to improve their body image and, create maybe a healthier behavior or reaction to self?
And Robin, as a therapist, you might be able to speak to this. There's so many healthy coping skills out there, ways to sort of rewire our thoughts in ways that improve our body image. So, one thing I've noticed, at least in my line of work, is to just assess the ways that someone talks about their body, the way that they think about it, sort of rewiring that negative self talk into where we start is neutral self talk. So having body neutrality, um, and catching ourselves in the act when we talk or think about ourselves negatively. It can be a big first step in healing a negative body image into something that we feel more neutral or positive about. Switching up the self-talk does a lot of wonders that I notice. And as we mentioned earlier, social media, sort of auditing your social media, can be super impactful. It depends on their relationship with social media, obviously, but sort of taking a little bit more control of who you follow, what sort of content you're interacting with, that can make a huge difference. So, unfollowing people who advertise diet pills or engage in a lot of photoshopping and kind of rewiring that and following creators who are size inclusive and engage in neutral or positive body talk, or who make their social media a little bit more realistic as opposed to just the highlight reel. Um, Even just taking social media breaks can do a lot. So I would say those are two big big starting points for sure.
I feel like we recommend that, um, at least I do, to everybody to take social media breaks, because I think we all can be negatively impacted one way or another, right, by too much
Mm-hmm.
scrolling. I heard a name, and don't laugh at me because you probably know this already, but I think I was watching some news show, and they called it dread scrolling, like
Mm.
only looking like through all the bad news stuff, like that's it, looking for the
Oh,
bad, so
yes.
creating a sense of dread, literally, like. So I agree. I think this is something, and you're right. We do. I think mindfulness practices are wonderful things, and the options that you just shared, right? Switching out who you follow, who you don't follow. It's so weird for me to use this language because I'm not on any social media. So, um,
Good for you.
but and the comparison, right? That's what I call it. Like, stop going comparison shopping. Stay present in your own
Mm-hmm.
life. So I appreciate using those, or suggesting those techniques for whoever I work with, and apparently you do the same with those that you work with. So that is great.
And this is difficult. I like to put guests on the spot sometimes. You had 1 minute, right, to speak to someone, to give someone some hope, give someone some education. What would you tell them in that 1 minute? Someone struggling with their negative body image.
Ooh, I would say, if I just had a minute, just to start with the neutrality model. So, just reminding yourself of the things that your body does for you in a neutral sense. So, my legs take me from one place to another. My arms help me to hug people. My legs take me out to get fresh air. My ears help me hear music, stuff like that. So instead of thinking, I don't like the way that this thing looks, this is too big, this part of me is too small, I want to change this thing, just start with, what does everything do? What's its purpose? What does it do for you in a neutral sense? And I think that that is a really realistic place to start, um, just in the sense of improving the way that you feel about your body, because it does do a lot for us regardless of how it looks or how you feel about it. There are so many things that our bodies do that we don't stop to appreciate. So taking a sort of neutrality and gratitude model is a great starting place.
That's great. I thank you so much for sharing your experiences with us, Kelly. We really appreciate it. And of course, we appreciate your time. It's a lot of really great information. And I just want to conclude, though, by saying, if you, or this is to our audience, if you or someone you know needs support, resources, or treatment options, the National Eating Disorder Association has a helpline to call or text. And you can call it 800-931-2237, or for immediate help, you can text NEDA to 741-741. Another interesting and excellent podcast.
Yeah, it's great when we have such knowledgeable guests on the show, because I feel like just having these open conversations is good. We get to knock out some questions we have, and hopefully it's very useful to the audience as well. It's been great having you, Kelly. Thank you for joining us. And Robin, till next time.
Before we log off, tell us, who is that? Who's making their presence? Your kitty cat.
Oh, that's Kirby. He's just been hanging out, bothering me the whole time.
Well, we are very animal friendly here, so we love when animals drop in to the podcast at any time. So please, anytime you like to come back, love to have you and Kirby back.
Thank you. He loves to be where the action is. It was my pleasure being here. Thank you guys so much.
Thank
See you guys.
Bye, everybody.